Ospital ng Makati is the premier hospital of the Makati Health Service Delivery Network, certified by DOH as a tertiary hospital. Also known as OsMak, the hospital is comparable in most aspects and functions to a world-class private hospital. With a 300-bed capacity, OsMak offers an unparalleled spectrum of multispecialty healthcare services. It is one of the few LGU-owned hospitals with ISO certification by SGS Philippines. The Department of Family and Community Medicine is one of the 12 residency training programs of Ospital ng Makati. It provides primary health care in both hospital and community settings, geriatric medicine, palliative and hospice care, smoking cessation services, clinical nutrition services, and many more. The Family Medicine Clinic, with its medical equipment and instruments, is our venue for consultation. 2 family medicine clinic officers attend to an average of 40 consultations daily. Our counseling room is perfectly designed to conduct family meetings and conferences. Inside the counseling room is a mini library with various resources, as well as a computer desktop with electronic resources for maximum learning opportunities.
Before the COVID-19 pandemic, the department catered face-to-face consultations at the Family Medicine Clinic, counseling room, smoking cessation clinic, and our partner community. Residents rotated in the different specializations of the hospital in the outpatient and inpatient services. We cater consultations, immunizations, health education, and COPC project implementation in our adopted community at Barangay Southside, Makati. Our consultants conduct weekly lectures on family medicine concepts, quality assurance, research, and subspecialties such as palliative, hospice care, and geriatrics. In addition, residents have regular reporting of clinical and family cases, clinical practice guidelines, and evidence-based medicine. Supplemental lectures in the aspects of mental health, toxicology, and infectious disease are also scheduled.
Since the declaration of the COVID-19 pandemic by the World Health Organization last March 11, the Department of Family and Community Medicine residents, consultants, and staff have been in the forefront in various aspects of the new normal. We will continue to rise above the expectations and to adapt and cope with uncertainties. Our training has imprinted to us the importance of maintaining and providing the accessible primary health care services to all our patients. We will continue to respond to the challenges brought about by the COVID-19 pandemic. Our community depends on us, and we will continue to deliver healthcare services in countless innovative ways. During these present times, the residents are involved in the operations such as intensified screening areas, teletriage, FMC telemedicine used to conduct online patient consultations and family meetings, and external fast track, which provides acute care management. Here we are at the Pembo Quarantine Facility, or PQF, which is one of the community quarantine facilities in the city government of Makati, which caters 45-bed capacity for the patients. The FM resident on duty is in charge of the admission and discharge of patients while providing a holistic, biopsychosocial approach of management during the entire stay in the facility. Weekly clinical and family case reports by residents are now done via online platforms. Family medicine concepts, hospice and palliative lecture series, geriatric lectures are also presented by consultants in a Zoom platform. Trainees are required to attend the lecture series of research of the PAFP recap, the Rajakumar movement, and PathPro. The PAFP quarterly examinations are done through PAFP Primary Care app taken by all residents simultaneously in the vicinity, observing physical distancing. The exams are proctored by the department chairperson and the consultant on duty. Checking of portfolio, mentoring sessions, and research updates are done on a regular basis. It is, without a doubt, that the residents and consultants of the Department of Family and Community Medicine exemplify the 5-star physician, which all family doctors are called to embody and radiate throughout the profession.
Ospital ng Makati Family Medicine residents continue its pledge of commitment in supporting to OsMak and PAFP organizations and its related activities. We, as residents, are encouraged to join in the organizations we wish to join that will cultivate our interpersonal skills. Some of our residents are in OsMak Residence Physician Organization and PAFP Residence Organization, while some are in QA-related activities. A variety of webinars are attended regularly that will include geriatrics, hospice and palliative, and mental health that will enrich our skills as 5-star physician. Annually, we are hosting postgraduate course that will help our colleagues in the field of primary care. In the aim of work-life balance, we also have strategic planning, team building, Valentine's street activity, and Christmas party. With this, we as residents are geared towards socially adaptable and responsive, dynamic to the challenging times, and at par with the global demands.
Our strong points are the quality of residents we accept into the department and how our consultants are committed in the training program like it is our baby. What we have is common passion and dedication for what would be best for our patients, and we are fortunate enough to have residents who share the same passion with us and even go beyond the residency training in building quality assurance of service delivery and care. The program's main goal is mastering primary care with evidence-based knowledge and even going beyond it for the good of our patients, their families, and the communities. Like I always say, go the extra mile for your patients and their families. We go towards individualized patient care and community-oriented service. In the same way we do to our residents, we go towards personalized approach for the trainees to be tomorrow's resilient 5-star that pack OsMak family physicians.
Service,
Professionalism, adaptability, respect,
research-oriented, compassion,
communication skills, commitment,
competence, leadership,
integrity, nationalism, global competence,
The Ospital Makati Department of Family and Community Medicine aims to train compassionate and competent family physicians in order to deliver excellent holistic care that ensures client satisfaction utilizing evidence-based technologies and treatment modalities. In this COVID-19 crisis, the members of this department, consultants and residents alike, have gone beyond their call of duty when they stepped up to the plate, assuming responsibilities in the front line. It is my personal mission for the department to continue serving in all circumstances, pandemic or not, and at the same time balancing to strive to be the 5-star family physicians that all consultants assume and all the residents aspire to be.
Ospital ng Makati, Department of Family and Community Medicine.
Thank you, dear doctors, for visiting us at the Department of Family and Community Medicine of the Ospital ng Makati. We hope that we have enlightened you with our progress towards certain health for all, even in the midst of uncertainty.